Homoeo Guru. Please subscribe our channel. Press bell icon to get continuous updates about new videos. Topic based video part 30. Anatomy of spleen. Spleen is a secondary lymphoid organ. Develops in 6th week of intrauterine life. Spleen is covered by peritoneum except in hilum. It is also known as graveyard of RBC. Location. Spleen is situated in left hypochondrium. Extend from 9 to 11 ribs. Weight 150 gram. Length 12 centimeter. Visceral relations. Left kidney, splenic flexure of colon, tail of pancreas, stomach. Ligaments. Gastrosplenic ligaments. It extends from greater curvature of stomach to the hilum of spleen. Content short gastric artery. Lienorenal ligament. It extends from hilum of spleen to the anterior surface of kidney. Content splenic artery. Phrenicocholic ligament. It extends from splenic flexure of colon to diaphragm. Not attached to spleen, but support its anterior end of spleen. Vessels. Splenic artery and splenic vein. Nerve supply. Spleen is innervated by autonomic nerves from the celiac plexus. Questions. Spleen extends from 6th to 9th ribs, 9th to 11th ribs, 6th to 11th ribs, and none of these. Answer. Spleen extends from 9th to 11th ribs. All are visceral relation of spleen except stomach, kidney, adrenal gland, colon. Answer. Adrenal gland. Splenic artery is a branch of superior mesenteric artery, inferior mesenteric artery, celiac artery, and hepatic artery. Answer. Splenic artery is a branch of celiac artery. Length of spleen 12 cm, 8 cm, 5 cm, and 20 cm. Correct answer is 12 cm. Graveyard of RBC. Liver, adrenal gland, spleen, bone marrow. Answer. Spleen. Thank you.